Esophageal cancer has been rapidly increasing. The American Cancer Society estimates there will be 22,370 people diagnosed with the new esophageal cancer in 2024 and more than 16,000 deaths from esophageal cancer this year. Dr. Christopher Riesing joined us to share about esophageal health signs and symptoms, plus discuss myths behind medication and, of course, the importance of screening. Dr. Riesing, thank you so much for joining us.
Thank you.
All right, so we're talking about esophageal health.
Yeah.
What is that?
Our goal is to keep your esophagus healthy and prevent cancers and the precursors to cancer. So when I think of esophageal health, it's about making sure patients know what risk factors are for those diseases and that we're treating them early on in their stage.
Okay, and often I think we hear about acid reflux, we hear about GERD, there's always commercials about medications to help treat that.
Right.
So for those who may not be familiar or they go, oh, I know what acid reflux is, I have that. Tell us about those two conditions. What are the symptoms and who typically suffers from acid reflux and GERD?
So GERD means gastroesophageal reflux disease. That's a mouthful, but the typical symptoms are heartburn, almost like a lava sensation in your esophagus, or regurgitation, where food that you ate when you bend over might come up into your throat, or bile or acid. Those are the typical symptoms, and so people seek treatment for that with over-the-counter medications. We call them proton pump inhibitors, or PPIs. Omeprazole is a generic name for that. And it's important to see your doctor if you're having those symptoms too, not just self-medicate. Well, those symptoms that you feel are really injury happening to the esophagus. The esophagus is not meant or built to handle acid exposure like the stomach is, where it's created. And so there's a burn that happens, and that burn injury can lead to precancer changes. One of those is Barrett's esophagus. And Barrett's untreated or poorly treated can then evolve to cancer. So that's really what we're trying to diagnose early, treat, surveil. And there are now techniques to eradicate Barrett's esophagus, if we know it's there, that can avoid cancer development.
Okay.
But it starts with screening, and it starts with going to your doctor, not just self-medicating.
At what point should they put the Prilosec down and really make sure that they're getting something checked?
Really, any trial that you would do over-the-counter medication should only be a few weeks long.
Okay.
And then if it's recurrent after that, you really should seek the attention of your doctor. We talked about patients self-medicating for long periods of time, and that's not safe. We would want to start by looking in your esophagus with an endoscopy to make sure there's not another more advanced diagnosis, or even some of the anatomical problems like a hiatal hernia, where the diaphragm stretches around the esophagus and part of the stomach slides up and down, promoting acid reflux.
Are some of these hereditary?
They are. So some of the risk factors just are, you could be born with a hiatal hernia, or you could acquire one over time. We know smoking has an increased incidence of hiatal hernias and reflux. But even more importantly, for Barrett's esophagus, to screen for that and esophageal cancer, we know that white males have a higher incidence, obesity, so body mass index over 30, a history of smoking, certainly anybody that's on antacid medication, or if you have a family history of Barrett's esophagus or esophageal cancer, you should get screened. So as people are going in to get their colonoscopy, for example, perfect time to have an upper endoscopy if you fall into any of those categories and have 3 of those criteria.
Okay, and doctor, where can people go to learn more?
StAlphonsus.org. There's a website. There's my landing page, Chris Riesing, MD. We focus on thoracic foregut surgery, and there's segments of that website that focus on Barrett's and esophageal cancer.
Wonderful. Dr. Riesing, thank you so much.
Thank you.
Greatly appreciate it.
Thank you so much.